We can't make you a morning person, but we can make your mornings better. Switch on to 94.3 Royal FM. Sponsored by MTN. MTN. Everywhere you go.
Hey, good morning once again and welcome to the 8 at 8 conversation. Jesse here, the African Sun. It's a good morning. It doesn't sound like living entrepreneurship today because every other conversation can cease and we have a timely and very important conversation with us. And it's a conversation of importance. Now listen, you've heard about GBV. You've had every conversation to do with these 16 days. Last night, we had this launch of, the messaging which has been going on in a fancy place, by the way, high-level conversation where we had the opportunity to be invited. Juliana said the food was even better.
Oh yeah, the food was better. The plantain was yummy. I mean, we were in a very interesting, very lovely environment. I have never been there. I mean, I didn't even think such places exist in town. But yeah, I was impressed. It was a low-key, interesting, calm, high-end. I don't know what I can say. But it was really nice. I loved it.
It's the ongoing conversation on the 16 days activism against gender-based violence. And the conversation is around digital GBV. This morning we have a very dear friend from Rubicon, the ever smiling, beautiful Isabel Masozera. Good morning, Isabel, and welcome to Kigali.
Making me blush before I even say anything.
Good morning, Isabella.
Good morning. Thank you so much for having me,
First of all,
Jessie
you
and
look
Juliana.
beautiful.
Oh, thank you.
And thank you very much for inviting us last night. I mean, first of all, how did you get that location? it is really fantastic.
Oh, wow. We're digging into the deep end very quickly. But honestly, the incredible team at the Ministry of Gender and Family Promotion and in collaboration with UNFPA came up with this incredible campaign during the 16 days of activism to highlight technology facilitated GBV. And they wanted to create a space that was able to be a catalyst for open communication, because many times when we are in conferences, when we are in these four walls, there's a certain timidness. So you have people on the podium, people on the panels, and it feels like they're talking at other people. But we wanted a space where everybody can just come together. We can enjoy some good music about the same conversation. We can also enjoy conversations, learning from each other, a lot of unlearning. And so we wanted to find a space like that, and the governor's residence was the team there was very kind to actually allow us. This is not something they always do, but they were like, okay, for you guys, we'll let you have the space and have the conversation. We're so happy that you enjoyed it.
Interesting. I know that we are going to be joined by somebody online to have a conversation with us, technology-enabled conversation. Would you mind to introduce to us who this person is?
Yes. So the Director General of Gender at the Ministry of Gender and Family Promotion, Mr. Lynn, is going to be joining us. And she is one of the forces behind this campaign. I've been truly honored to learn from her, to listen to her, to understand technology-facilitated GBV more. So I cannot wait for her to join the conversation. To be honest, joining the campaign and being part of this, I thought I knew what, like you called it, digital GBV is, but I realized very quickly I had no idea because it manifests in so many forms. So really looking forward to
I'll give you the opportunity to give a cue in to Arlene to join us.
Yes.
And we'll be able to have her for this conversation today. My takeout from last evening is for all stakeholders saying that the conversation on GBV cannot be really put in brackets of limitations 16 days, that it has to be a very continuous conversation and to have everyone onboarded, men, children and everyone. I think let me first get Aline online. Good morning, Aline.
Good morning.
We're happy and excited to have you here today.
My pleasure.
Good morning, Aline.
Good morning.
It was nice meeting you last night.
Yeah, it was amazing.
And we're glad to bring the conversation live on radio.
Yeah. Thank you so much for the invite.
Yeah, we're here with Isabel, and we'd like maybe to start this conversation with you answering some of these questions that we have this morning prepared for you. What has been the impact of Rwanda's initiatives to combat gender-based violence so far, and what areas require more focused attention in your perspective?
Thank you so much. Rwanda has done so much. More steps has been made to combat GBV. And I would also like to admit that, as you said, there is a lot that still needs to be done, given that the GBV is evolving, GBV is changing so much, and it's getting worse, even in regards to the impact, negative impact it's creating in people's lives. So Rwanda made significant achievements when it comes to, first of all, we would like to we really appreciate the high political will that underlies all the initiatives that and the interventions that are being made. We have the policy framework. We have the policies in place, though that they require to be reviewed and updated given the trends and all these developments. We have the legal framework as well. We have the institutional framework. We have a strong institutional framework and the coordination mechanism. And we also have the community initiatives. There are community interventions as part of being self-reliant and self-resilient, and they're finding solutions for themselves. And the issue with this is that they cover small scopes, but when they are strengthened, when they are empowered, they are able to create significant positive change.
You mentioned that GBV manifests in several ways, but yet this year you've picked on a theme which is technology-enabled GBV. Why in particular did you pick on this?
This year in particular, we chose a theme that was talking about all for GBV-free families. And one of the 3 or 4 big things, big achievements we wanted to talk about were the tech-facilitated GBV campaign, because the tech-facilitated GBV is also on rise, and people are not aware. We did this campaign as part of the 16 days of activism, but which might also go beyond the 16 days of activism to create the awareness. Are the people aware? Because we don't have the data. When it comes to the people reporting or people at risk, we are only able to intervene after creating people's awareness, and afterwards they will be able to report or even to spot that this is a danger zone for me or for my family members. And afterwards, that's when we'll be able to do interventions, programs tailored to this particular issue. We see the technology, the devices, the media, the social media, and so on, the internet also on speed. It means that when we want to combat GBV, we have to do both sides offline, but also online. So this is what inspired our initiative to create awareness, so that people are aware that they are not only in danger when they are at home or even in the community, but also online, because some people might avoid to go in the community, stay in their safe spaces, their homes, their bedrooms, yet there is also danger online.
Allow me to bring in Isabel here. Yesterday at the event, somebody brought in an example of a digital-enabled GBV, and they spoke about the former Miss Rwanda.
Yes.
How was that digital-enabled GBV for us to have an understanding? How did it manifest?
I cannot speak for the person, but what I understood from what they were trying to raise is sometimes there's a culture of being bystanders, right? Not just about the specific institutions they were perhaps highlighting, but even us in this room. So there are people online that are just vile. They come online just like others come to seek solace, community, a place of learning, a place of connecting. Other people come on there to just let out the anger in them, to just let out the rage in them, the trauma they've gone through, and all this dumping. And at the end of the day, they're hiding behind these phones, these machines, so they can detach that humanity. So in the case of, say, Miss Rwanda or any other person that has been trolled online or has been highlighted in one way or another that may come off negative, this is the situation that is happening. And so I think as a community, as a society, every single one of us, when you see people are taking a conversation out of context, a narrative out of context, without sometimes really understanding the reasoning behind why something, for example, has been published, I would say. So we have had situations where communication is necessary to the general public. And I'm not specifically speaking about the case of Miss Rwanda, right? Maybe an institution is trying to show how important it is for us not to drink and drive. And they put this content on there. Now, before you think about them and what they've done, the question is you. What have you done with that information? Because it is you who is going to repost it, circulate it, give it that visibility to even the wrong people who are going to take it out of context, troll this young lady to a point of her feeling like she does not belong, feeling like she's being harassed. Language is being used to talk about her mental health, to talk about how there's conversations around, people are diagnosing her with mental illness online. That already has gone away from the initial post and its intention. And so for me, I'm always very careful when we start up and say, okay, so and so you shouldn't have done this, so and so. Yes, they shouldn't have done it, but what about you? And for me, the institution that I always want to begin with is the media. Because the media will spearhead what narrative it takes. It will we've seen scenarios where, for example, we are condemning, say, maybe nudity. As a culture, as a society, maybe this is not the direction we want to encourage. And so we decide maybe we are putting out something. Now, whether it is right or wrong does not become the conversation. The conversation is when it gets into this digital space, is it weaponized? So my plea to the general public is, we like to talk about things on surface level. We like to not take accountability. And where I want the conversation to go is the internet. Can we think about it the same way we think about the physical? Whatever you're putting out there, can you really look into Isabel's eyes and say, Isabel, you're fat, you're ugly, you're this, you're that. I think you have mental health problems. That is why this and this and this and this is. Can you do that? So why are you doing it online? Because you're inflicting psychological, harm on another human being. And mark you, the internet is forever. There's a digital footprint left every single time something is put out there. When Isabel goes for an interview, are you thinking about the fact that Isabel's employer is going to search for Isabel. And what is it that is going to first come out?
Well, unfortunately, the world, I do not know what we're going to do, but we do not have control of social media. We are not in control of what happens on social media.
But we are in control of
What we
ourselves.
can-
What
we
we
post.
can do about it. Yes.
Now, speaking of that, I'll ask, she's still online, how are communities being involved in the fight against GBV, and what role does cultural transformation play in ensuring sustainable progress?
Aline, that's your question, I bet.
Thank you so much for the question. The people, the community, the population have to stay at the center of what we do. There wouldn't be any meaning developing policies, putting on laws that are not benefiting or serving the general community. So what we do is to keep on educating and doing awareness campaigns, but also developing the tools for the community to be able to teach themselves, to help themselves, but also in prevention, but also where to report, reinforce the mechanisms where they have to report, so that they also come and feel free to share what happened to them and be able to get the integrated packages that the victims need for them to go back to the community. And I would say that we do both the prevention but also the response, and also encourage the community to be able to understand the magnitude of this issue, but also to contribute to the effort to prevent and to respond, because they have a responsibility. Somewhere, somehow, they have the responsibility. The reinforcers, the institution are not able to protect them if they are not able to protect themselves. They have to also play a role as a key stakeholder, not as a beneficiary, to be able to make a stop to this issue.
Aline, I would like to challenge you to touch into the space of GBV and try to paint a picture for us and for everyone who is listening. How big is the issue of GBV in our country?
How big? The issue is there, and that's why all these efforts are made to be able to combat GBV in general. The magnitude doesn't stop at the victim level, but it also affects the family dynamics, the relationships. It affects the community. It contributes to human security issues, and it also perpetuates the poverty, the cycle of poverty, the cycle of dependence. And we would say that the majority of the victims are women, though we see some of the men that are bold enough, courageous to come to report for GBV cases. So
are you able to highlight?
The issue is there, but and the negative impacts are huge, and it's not even easy to quantify. But maybe let me give a small example. Okay, I wouldn't say it's small. The ministry covers all the costs that goes on GBV victims when it comes to medical and non-medical when they go to the Isange One Stop Center.
Okay.
Last year, the fiscal year 2022, 2023, no, 2023, 2024, only on medical bills, the government has paid 430 million Rwandan francs on medical bills to the people going to Isange.
Oh, wow.
1 billion, 4 million, 30 something, only for medical.
That's a
without
great economic
considering
impact.
without talking about the non-medical. And this is only when they're at Isange. Figure out that money will increase when they are accessing the non-medical and when they go back to the community for the victims to be able to be self-reliant, once again, to recover that self-confidence, it requires reintegration at individual level, reintegration at family level, reintegration at community level. And this reintegration requires the psychological access to justice, the safety, the socio-economic reintegration. All this requires finances. So this is how big it is. And you could imagine if we do like simple math, that this money can be even be multiplied by 4 or even 5 if the victims was having the full package. So this money is huge, and this is not counting the qualitative, the negative consequences that are affecting the people, the mental health, the stigma, the not being able to contribute to the economic, like the income generating activities, and even the consequences that can even reach to death. You can't imagine how many children lack parents because one partner killed the other. You cannot count. So this is a lot, and the budget that goes into the trials in the courts, to feed them in the prison, in the correctional services, and so on. So this is how I am able maybe to
paint a picture. Yes.
Of how the magnitude is. Yeah, and imagine the consequences that are reaching the people who are not even able to go to seek for help, to seek for services. Yeah, that are staying home. They're down there. They're depressed. They are isolated. This is really, really huge. This is why we need all of you, even the media, to be able to amplify how big and negative and bad this issue of GBV is.
We're here to give all the support. I would like us to talk about your mandate at Major Prof. I know education is key to breaking the cycle of violence, but specifically, what is being done to educate young people about gender equality and GBV prevention?
Thank you so much. We have outreaches in schools. We have activities that to fight against teenage pregnancy in schools, campaigns. We have, on the other hand, we have a high learning institution, dialogues with high learning institutions, talking about gender, what is gender. And there are gender clubs in some of the schools, and that's why we encourage schools also to create these platforms so that the students are able to have on their agenda of what they discuss, to have gender. We have gender mainstreaming minimum. We have a simplified guide for mainstreaming gender and to educate gender, and in different platforms such as Mugoroba w'Imiryango, we have the family evening gatherings that happen once a month. We develop content that are really simple, easy to digest for the community to understand what is gender. So we diversify the topics when it comes to education, but definitely that every other month or once a quarter, we talk about gender. What is gender? What are the concepts? And what are the people able to do as gender transformative approaches that address gender issues in their community?
Tell me about this Umugoroba w'Umuryango. I'll be interested to hear about this. When does it happen? I've never heard about it. No one has ever invited me into that space.
No one has to invite you. It happens once a month, generally for specific provinces and the city of Kigali. It happens on the third Sunday of every month. But for the Eastern Province, it happens on the fourth Thursday of the month. Fourth Thursday of the month.
Okay.
And the content are developed at ministry level, and they are shared throughout the existing sharing platforms that we have. They go to the district, and the district is able to centralize the messaging. And in those platforms, it's a good platform for education, but also for the village members to know each other, to be able to address issues at village level before it escalates to sector level. And when there are people like in their neighborhood, in that same village, that are not attending those gatherings, it's an opportunity for the committee of Umugoro Imiryango, because they have an elected committee, to go in their family. Maybe the issue they have at family level is preventing them to go gather with the remaining of the neighbors. So they also, in their mandate, in their assignment, there is this family visitation, so that the issues they have that was not addressed within the Umugoro Imiryango is able to be addressed during this family visitation. And this committee doesn't work alone. They work as a team with the Inshuti Z'Umuryango. They work as a team with the community health workers. Maybe the issue that family is facing is a health issue that the community health workers are able to respond to. So this is how it works, and they have they work for 3 years renewable. And these are people with integrity within the village. So they have to, the committee belongs to that particular village, and when they are elected, they become, they undertake the responsibility they undertake the responsibility to do the family visitation, to organize the family gatherings, the evening family gatherings, but also to do the reporting and to keep on that dynamics, that harmony within the village.
Okay.
I have a final question. Earlier on, you mentioned that you actually have more cases of GBV from women than men. Is it because men in our society, in our communities, are still holding back? They still fear to report that they are being violated because of the culture that men are not supposed to speak out, or because they should man up according to the culture? A man should not even cry, a man should not even report,
swallow their pain.
You know, and what are you doing to sensitize the communities, and most especially the men, that they also have a right to speak out and report these cases?
When we talk about gender, when GBV, when we are campaigning, we are not talking about GBV perpetrated against women or perpetrated against men only. We take GBV as an issue that can affect either men or women. And when we are educating, we talk about the numbers. When we are able to retrieve them, we talk about the numbers, but we also take into consideration the social norms, the cultural, the background, our history, and all that contributes to the fact that men are not reporting. And what we do, we encourage both men and women to report when they are facing GBV. And the policies and the laws are really open and caters for the needs for both men and women when they are at risk, or even when they are victimized by their counterparts. Yeah.
Okay.
Let me just wonder, before you sign off, we're coming to a new year, 2025. I bet you don't want to do things the same way. You want to amplify the effort. Is there anything that you're excited about doing in the new year around your very, very core responsibility in the space of GBV?
Yes. We are currently we are reviewing the GBV law, and I see more avenues to address even the new trends of GBV, such as the sex-assisted GBV. And another thing that I'm excited about is to bringing more partners, stakeholders on board, including the media, including the private sector, so that we fight this as a whole, because the people affected by GBV, they are the same employers within the private sector. They are employees within the private sector. They are church leaders. They are even church attendants. This is a general concern to everyone, and if we are able to educate, but also to use different platforms and different approaches depending on the stakeholder, we'll be able to do things differently and able to address this issue in its integral aspect.
I see you have a lot of work to do, Arlene, there at Major Prof. I would like to appreciate you so much for the time you spared to be with us for this conversation.
You're welcome.
I also want to encourage you to take some rest. It's the Christmas season. Do you have any plans for Christmas?
Students are coming in the holidays, and we will be able to. We need to be able to rest, but also to take care of them so that they are not at risk. So the work continues even in
the holidays,
festive season, in the holidays, and even in the new year as we start the new year. Let's start the new year and celebrate with our families for Christmas, but always have in mind that everyone has to contribute to GBV-free families.
Thank you so much, Arlene, and we wish you a
You're
good day.
welcome.
Oh, yes,
Good
indeed.
day. Thank you.
Thank you, Arlene, there from Major Prof. And we have Isabella, who has been at the center of organizing and putting together all this communication from Rubicon. As we sign off, Isabel, what has stood out for you, just being at the center of, putting together everything, communication around the 16 days?
A lot. But I want to begin by saying it has been truly moving being part of this campaign. As a communication specialist, you often work on campaigns that are just a box to tick. But it's interesting that you said, when is she resting? I think that question should have come from me. Because I am telling you, the team at Measure Prof and UNFPA, they're sending emails like way past their working hours at midnight, trying to make sure, I know she's traveling. They have so much that they're doing as the ministry, even outside of this particular campaign. But she woke up very early this morning to be on this show. And she was yesterday on a panel, at an event that went late into the night. So seeing that passion and that urgency from these institutions for me has been very, very moving. This is something that they're doing because they can see that there's a problem and they're willing to not just talk the talk, but they're doing something. I said the other thing has been the media. Royal FM. I have to give you your flowers. When we came into this, we said we were going to do things a little different, very unconventional. So we employed unique tools like having a theme song around GBV. And Royal FM was the first station to agree to actually premiere this song. I know the partnership with the media is something I will always emphasize because we've seen how powerful the media can be in Rwanda and everywhere. Going way back to 1994, the role the media played in perpetuating the genocide, right? But also seeing people in the media understanding their power and standing in that truth and saying, I, Juliana, I, Jesse, I am going to have this conversation. And so I am so appreciative of seeing that level of collaboration and partnership and accountability, saying, okay, we have a role to play and we are going to do it. And even yesterday, not just Royal FM, we had, I can't mention which media houses, but they came out in big numbers yesterday to have the conversation, to educate themselves and to help spread the word. But truly, truly appreciative of the artists that came on board. Della Dube.
And the poetic girl.
Yes, Della
Black
Dube.
girls.
She she wrote an original poem, and
was
you
nice.
could see that we were all moved to the core. So that authenticity that has gone into this campaign, but also seeing the reaction. When we had the Car-Free Day, we had men, we had women, we had children come out to take that stand and say we want safe spaces both offline and online. And so there's so much. I could talk on and on, honestly, but I just want to call on everybody. This is our fight. I think I just want to end on a very personal note. It's far-fetched until you've experienced it or watched somebody you care about experience it. In the pandemic, my daughter was a victim. I don't want to use the
Online?
word victim. I want to say survivor. Yes.
Online of
Yes.
GBV.
Yes. And I think maybe, Jesse, you could have seen this video. She did a video to say happy birthday to her dad. She was only 9 years or 10 years at the time. And she sang happy birthday. And she had this little T-shirt. She's so intentional and thoughtful. She made a T-shirt with her dad's name saying, I think he's like, some really, really remarkable words, beautiful words that she came up with original, got a T-shirt done in his favorite color, wore it, and wished him a happy birthday, put the video online. Somebody came and commented that she's pregnant.
Oh my God.
Yes, because
A
she was
nine- a
seated in a
9-year-old?
particular angle, and maybe her tummy,
T-shirt
The
was
T-shirt
a
was
bit
baggy.
baggy.
yeah, the
Yeah.
T-shirt looked a type of way. This is a 9-10-year-old, and you can see that this is a child. If you have a concern, why not DM? And I remember somehow my daughter saw this post. Now, at the time, my daughter was going through bullying at the school. And so she used to create content to educate parents about, and I don't know if the general public noticed, but at a certain time, we had to take our daughter offline after
Yeah.
a series of those things. Delete her Instagram and a couple of, so many elements did feed into that. But I just want people to understand that this thing is serious. This child now is having body issues. She suddenly, mommy, I don't want to wear this, mommy, I don't. You did that with one comment. You're causing someone years of therapy, and this could even cripple into their future.
Yes.
I myself, I went off completely Twitter. I don't know if anybody noticed, but I've not been on Twitter for almost a year and a half. I go on Twitter
It's
just
now
to
called
post.
X when you return.
When you returned, it was X. When I returned, it was X. Because of that, how toxic
I know.
Twitter can be. And I want to point out specifically Rwandan Twitter and how toxic we can be. Somebody will write something, maybe they're distracted, you're going to take it out of context, and you're not going to even take one moment to see things from their point of view, and you forget there's a human being.
At some point you start worrying if really social media is a safe place.
Is a
for
safe
everyone.
space,
If it's worth
and
it.
people are going to therapy because
know.
of being online. So again, I just want to remind everybody: choose kindness, choose empathy.
Sure.
Ask yourself, would I want to read this beginning my day or ending my day? What kind of night am I going to have? And if you can answer that question, go ahead and type.
You
I
need to have
appreciate
a
it.
very thick skin to
Very
be there.
beautiful, very beautiful way to bring the conversation to an end. Appreciate it, Isabel. I would have asked you what your skin routine is to keep looking as
Because she's
beautiful as you
glowing.
do.
I am
know.
offline
Who
most
wakes
of the
up- who
time.
wakes up like this?
I'm about to ask the same thing.
No,
off
you'll ask
air.
offline.
I need to know how. why
News
she's
is way too
glowing.
late, but we had to bring this conversation through. Thank you so much for being with us.
Kigali in the morning.